My name's Diane Heinson and I'm part of the Back Care Advisory Service for County Durham and Darlington NHS Foundation Trust. Slide sheets are low friction fabric to allow safe movement of patients. The reason that we need to use slide sheets to move patients is to reduce the friction and shearing forces for the staff to prevent musculoskeletal injury and for comfort of the patients as well. The repositioning tasks that are performed are taking the patient up the bed, to do a lateral transfer, perhaps bed to trolley, or to turn the patient. In our trust, we used to use flat slide sheets. However, for slide sheets to be used well and safely, you must have two layers. There are many slide sheets available. There are flat slide sheets of different sizes. There are tubular slide sheets of different sizes. So a tube is continuous on one end so that it moves and remains stable at all times. Our trust used to use flat slide sheets, but in our experience, staff used one slide sheet and didn't double it or use two. Therefore, the risk to the staff's health, musculoskeletal health, was greater. To move a patient up, what staff did was put the slide sheet underneath the patient's head, the body, but the feet were exposed. Therefore, the friction was greater for the staff to move that patient. So what staff should have done was put a second slide sheet underneath the heels. The other disadvantage of this was the slide sheets are quite narrow as well. So grasping the slide sheet, they had to reach in a little bit, compromising the posture and the musculoskeletal health again. I thought long and hard about the ideal solution and developed a product called Versal, which is bed size and essentially a hybrid of traditional slide sheets. The innovation Versal is in effect two slide sheets, flat slide sheets offset. So the bottom is slightly shorter than the top at this end, and at the head end the top is slightly shorter than that. The design facilitates all horizontal movements with one placement. I made the first prototype myself to test in the training room with the back care team, and it worked well. I worried that it was too simple, but when we tried it out on our wards, the feedback was excellent. Staff felt the Versal reduced effort to reposition the patient, whether they were being transferred between bed and trolley or being repositioned in bed. As a result, staff felt less at risk of injury to themselves. This is so important because musculoskeletal injuries are the main cause of sickness absence in the NHS. The Trust has supported me in developing the Versal as a commercial product. It now means that reduced effort for patient repositioning in bed helps staff to go home healthy.